would like to have a final message from you for the masses. Ashok Seth.
So my final message on this is, see, the heart attack leaves no one. The heart attack, we always keep thinking that kisi aur ko hota hai. The heart attack can affect us. It can affect us at any time. And that is why we've actually got to be ready for it. It is not something which happens to others. It's going to happen to us, which is very important. So we really need to tackle it ourselves, always be at the front, always understand, and always take precautions. The second point, which I would like to make to everybody, is that during this COVID era, and you also mentioned it, and I want to emphasize on certain aspects, is that the heart attacks across the world, not just in India, across the world have decreased by 50%. And you know, we've always talked about stress and we've always talked about pollution, but there's never been a way to measure stress or measure pollution. And now is the time that we've measured it. For once, the whole community, due to lockdown, has actually gone into a low stress period. The stress index has gone down. We aren't chasing time. We've got time to ourselves. We're spending time in a proportionate manner. We're also trying to eat healthy, live healthy. Pollution has gone down. Look at as a collateral advantage of what's happened is that the pollution is down and the heart attacks have decreased. In fact, for us, the heart attacks have decreased by 70%. It just shows that how we can alter our lifestyle, which can actually decrease the scourge of a heart attack. And that's a clear example of the heart attacks decreasing during this time. So it's almost like we've gone into a meditation. We've always talked about it. It's a good example to say, if we change our lifestyle, if we add spirituality to science, if we follow the yogic pathways, then we would actually be able to help ourselves far greater than any drug and devices. And we can actually decrease our heart attack rates by 50% rather than just 10 and 20%. So I think it's a very important message that combine spirituality and science, combine good habits, decrease your stress levels by doing meditation and yoga, and then of course all that we have said, and we would be then coming out. My message is, heart attack can affect anyone. Look around yourselves. You always think that it'll affect somebody else. No, somebody very close to you, friend, relative has already had a heart attack. And it can affect any one of us at any time. So it's important that we understand every aspect. It's important that we update ourselves. And it's very important that we plan and strategize accordingly. The second important aspect of your lives that we are now witnessing is that during the COVID times, the heart attacks have decreased across the world. 30% in some areas, 50% down to even by 70% for us. We're seeing less heart attacks. And the reason we believe we're seeing less heart attacks is that in general across the world, stress levels have gone down. Most of the world is under lockdown. We're no more chasing time. We're sitting and relaxing at home. We're following a much more regulated and planned lifestyle. We've got more time for ourselves. We've got more time for spirituality. Pollution levels have come down and you can see that yourself, we're breathing fresh air. And those two very important factors of stressful life, eating the right food, no smoking, breathing good air, and living a healthy lifestyle is what has changed and decreased the heart attacks by 50%, more than any drug would have done. It's almost like we've all gone into a meditation. We've taken on to a yogic lifestyle in general. There are no wants, there are no needs, and there is no chasing. And that has helped us. It's a clear evidence in front of our eyes how if we combine spirituality to science, that we can cure ourselves, we can cure our body, we can cure our mind, we can cure disease process and even decrease heart attacks by 50% when the drugs only do it by 10 and 20%. So it provides us with an introspection that changing our lives, preventing disease process and preventing heart attacks is in our hands. And once this COVID era goes away and we come back into normal life, remember the learnings of the COVID era, not just about hand hygiene and cleanliness and masks, but remember that how we actually, this meditation form of lifestyle is going to be far more valuable also in the future.